Hello and welcome to your video on section 9.3 on cartilaginous joints. Our cartilaginous joints are going to have either hyaline cartilage or fibrocartilage between the bones. If we look at hyaline cartilage, remember that we are going to have this glassy type of membrane to it and lots of chondrocytes here just randomly dispersed throughout the cartilage matrix. And here with our fibrocartilage, we've got these long collagen bundles, and then the chondrocytes are all kind of fitting in between those parallel collagen fibers in a row. So there are some differences there. Well, we're also going to lack joint cavities here. Again, these are going to be found more in our synovial joints. And what's special about these cartilaginous joints is that they can range from being immobile to slightly mobile. And we just have two types of cartilaginous joints. We have our Syncrondroses and Symphysis. So first we'll start with the Syncrondroses. These are going to be bones joined by hyaline cartilage. And we'll see that they're immobile. So we're going to place them in a functional classification of synarthroses. So here is an example of one of these. We have in our long bones that epiphyseal plate where we have hyaline cartilage as the bone is still growing in length. And if we look at our costochondral joints, meaning the joint between the rib and the costal cartilage here and the sternum, that is going to be an example of a synchondrosis because we really don't want this area to move. And then we have our symphysis joints. We'll see in these joints we have pads of fibrocartilage between the articulating bones, and this helps to resist compression or it acts as a shock absorber. And we'll see just a little bit of slight mobility, so we'll place it in the functional classification of amphiarthroses. And our examples are the pubic symphysis here. So we have the symphyseal surface of each of our pubic bones here, and in between we have an interpubic disc that is made up of fibrocartilage. Now males, this is never going to open up, but in females, when they go through childbirth, we have a certain hormone that causes the joints to relax, and this area will open up just a little bit to allow that baby to pass through the birth canal. And we also have our intervertebral joint that sits between the two vertebral bodies, and this really helps to resist that compression and creates shock absorbers here. Now we have a clinical application here of costochondritis. This is when we have inflammation of that costochondral joint. We get localized chest pain, and we're not really sure what the cause of this is, but the guess is that it's due to some type of trauma or infection. And because we're having pain in the chest here, a lot of the time it's mistaken for myocardial infarction or a heart attack. And to get rid of this pain, we can treat it with non-steroidal anti-inflammatory drugs that'll hopefully also assist to get rid of some of the inflammation here from whatever caused this inflammation in the first place.